In the remote Himalayan hamlet of Bharmour in Himachal Pradesh, there was no orthopedic to examine Ajay Singh's persistent backache. So the local medical center arranged an online consultation with a specialist in the southern city of Chennai. He prescribed a line of treatment that local staff monitors. Like him, scores access highly qualified doctors hundreds of kilometers away through a telemedicine program launched last November. The constant irritation in Sanjay Sharma's throat is improving since he started medication prescribed after a virtual consultation with a specialist.
We have this facility close to our house. I would have had to have travelled at least 10 to 15 hours to a city to consult a doctor. I have saved both time and money.
Although most of rural India struggles with inadequate health facilities, availing healthcare in these Himalayan villages has been specially challenging. The tiny population and bad weather make it hard to attract medical staff. The nearest big city is 400 kilometers away.
Most of the time of the year, these are cut off from the rest of the world because of the heavy snowfall and blockage of the passes connecting these locations to the rest of district and the state. So people had no option but to get whatever treatment is available there, because either you have to airlift people, which at times gets very difficult.
Now local staff in two places, Bharmour and Pangi, has been trained to conduct tests such as ultrasounds and electrocardiograms. Specialists in city hospitals access the reports online. Satellite technology helps overcome the poor connectivity in these areas.
We have been able to cater to about 3,000 consultations in OPD consultations, and more than 60 tele-emergencies have been stabilized at these two locations since the inception of the program.
For this resident, a cardiologist's diagnosis of his brother's heart condition was timely. He needed quick attention.
The doctors told us he has a heart problem, a blockage. We went to Shimla city where doctors put in a stent. That solved the problem.
The telemedicine program is also helping women whose health problems in rural areas often get neglected.
Doctors here told me to consult a specialist for my persisting headaches. It was diagnosed as migraines. The medicines I have been taking for the past month are helping.
Fears that these difficult roads will cut them off from medical care have been eased for residents in this Himalayan hamlet. Anjana Pasricha for VOA News, New Delhi.